Module 2, we will discuss the incentives and payment adjustments associated with the quality programs we are discussing, and why it is critical to report PQRS in 2016, as doing so successfully will enable you to avoid the PQRS payment adjustment in 2018. Your successful participation in PQRS also will impact your value modifier in 2018, which could be an upward, neutral, or downward adjustment depending on your provider type. We'll go into more detail as to how a little later. Also, there are still incentives available for meaningful use in 2016, the final year in which Medicare EHR incentives will be paid. The charts on these slides show the incentives that are available in 2016, as well as the payment adjustments that will be assessed in 2018 based on your participation in the various programs included for all eligible professionals. This slide focuses on physicians, with the green columns indicating potential incentives and the red columns indicating potential payment adjustments, all of which would be assessed in 2018. For PQRS, 2014 was the final year for incentives. So starting in 2015 and continuing in 2016, your successful reporting in PQRS will enable you to avoid the 2% PQRS payment adjustment in 2018. For the value modifier, the assessment of the upward, neutral, or downward adjustment will depend on the size of the group in which the physician practices, or if he or she is a solo practitioner. For physicians in groups with 2 to 9 EPs, and for physicians who are solo practitioners, you will be subject to upward, neutral, or downward adjustments based on quality tiering for those who report for PQRS in 2015. The upward adjustment will be explained on a later slide, but the downward adjustment that these physicians could be assessed is either 1% or 2%. We'll go into detail as to how that upward adjustment is calculated later. For physicians in groups of 10 or more EPs, the downward adjustment that could be assessed is either 2% or 4%. Regardless of the size of the group or solo status, non-reporting of PQRS in 2016 means an automatic downward adjustment. For solo physicians and for physicians in groups of 2 to 9 EPs, the automatic value modifier downward adjustment is 2% for non-reporting. For physicians in groups of 10 or more EPs, the automatic value modifier reduction is 4%. This is in addition to the 2% reduction for PQRS. It is important to note that incentives are still available in 2016 for participating in the Meaningful Use program. This is the final year for which Medicare Meaningful Use incentives are available. If you are a successful Meaningful User in 2016, you can earn an incentive in the Medicare Meaningful Use program of anywhere between $2,000 and $4,000, depending on when you started the program. If you are participating in the Medicaid Meaningful Use program in 2016, your incentive could be $21,250 if you are starting this year, or up to $8,500 if you are already along your way in meaningful use. For those physicians who are eligible professionals in the Medicare Meaningful Use program and who do not successfully report in 2016, the meaningful use payment adjustment is 3% in 2018. So as you can see in the final column, it is critical that physicians participate in PQRS and meaningful use in 2016, so that you can maximize the incentives that are available and avoid the payment adjustments associated with each program in 2018. As mentioned earlier, CMS finalized the policy of including physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists for the assessment of the value modifier in 2018 based on 2016 PQRS performance. This slide details how these practitioners will fare under these programs during the 2016 performance year. As with the physicians, non-reporting of PQRS in 2016 will mean a 2% PQRS payment adjustment in 2018. For the 2018 value modifier, we will focus first on physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists who are solo practitioners and who are in groups that comprise only of non-physicians. Since 2018 is the first year for the assessment of the value modifier, if these EPs are PQRS reporters, then they will be subject to only an upward or neutral value modifier payment adjustment based on quality tiering, meaning these EPs will be held harmless from downward adjustments for poor performance. The amount of the upward adjustment would be a factor of 1x or 2x, which will be explained later. Next, we focus on physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists who are in groups that do include physicians. If the size of the group is 2 to 9 EPs, if they are PQRS reporting, they can be subject to upward, neutral, or downward adjustments based on quality tiering. The amount of the upward adjustment would be a factor of 1x or 2x, and the downward adjustment could be 1% or 2%. For groups that comprise of 10 or more EPs, the amount of the upward adjustment would be a factor of 2x or 4x, and the downward adjustment could be 2% or 4%. Regardless of the size of the group, if a PA, NP, CNS, or CRNA does not report PQRS in 2016, then there is an automatic downward payment adjustment for the 2018 value modifier of either 2% or 4%, depending on where you fall on the chart. These practitioners are not eligible for the Medicare Meaningful Use Program, so they would not be subject to the Medicare Meaningful Use payment adjustments in 2018. However, physician assistants and nurse practitioners who meet the requirements of the Medicaid program can earn incentives for the Meaningful Use program. The final column shows that for PAs, NPs, CNSs, and CRNAs who do not report PQRS in 2016 could be facing a total downward payment adjustment to Medicare reimbursement of 2% to 6% in 2018. The next slide shows the same programs and how they will affect reimbursement for non-physician practitioners who are not PAs, NPs, CNSs, or CRNAs. As for PQRS, all EPs listed are subject to payment adjustments for PQRS in 2018 if they do not successfully report in 2016. For the value modifier, these non-physician EPs will not be subject to the value modifier in 2018 based on their 2016 PQRS activity. However, these non-physician practitioners are included when CMS calculates the size of the group for purposes of assessing the value modifier to those EPs who are assessed the value modifier. So, for example, when we say physicians, PAs, NPs, CNSs, and CRNAs in groups of 10 or more EPs, we mean the total number of EPs, both physicians and all non-physician practitioners that constitute the entire group. As with the previous slide, non-physician practitioners and therapists on this slide are not eligible for the Medicare Meaningful Use Program, so the Medicare payment adjustments would not apply to these EPs. For the Medicaid Meaningful Use Program, certified nurse midwives can earn an incentive if they meet the criteria. There are no payment adjustments in the Medicaid Meaningful Use Program, so the maximum payment adjustment for the non-physician practitioners and therapists listed on this slide in 2018 is 2%. CMS has help desks for providers who have questions for each of the programs included in this module. Providers should contact these call centers as their primary contact with inquiries regarding PQRS, the value modifier, and the EHR Meaningful Use programs. A list of online resources available on the CMS website for each of the programs is found on this slide. You can find links to these sites in the description section below this video. That concludes Module 2 of the Medicare Quality Reporting Program's presentation for 2016. Thank you for watching. To view the remaining modules of this presentation, please see the links in the description section of this video. This MLN Connects video is part of the Medicare Learning Network. The information presented in this presentation was correct as of the date it was recorded. This presentation is not a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings.